Hello everyone, my name is Antonia Maria Walker. Welcome to my PowerPoint presentation on adult female survivors of childhood incest. The contents of this PowerPoint presentation contain what childhood incest looks like, why adult female survivors of childhood incest should be considered for crisis intervention, common mental health struggles that lead this population to crisis, common somatic and medical struggles experienced by this population, common social struggles experienced, evidence-based crisis interventions, cultural considerations, and a Christian perspective. According to Clar Shalamish and Coriat 2021, childhood incest describes a sexual encounter between a child and a blood relative, regardless of whether consent was given to the adult by the child. Because children are not autonomous or developed enough to make the same personal decisions as adults, most adults, any sexual act committed with children is considered sexual abuse, including incest. Childhood incest includes sharing pornographic material, sexually suggestive conversation with the child, sexual touching by either party, the child or the adult, and contact with or insertion of any body part or object with any orifice or other private area of the child. These survivors should be considered for crisis counseling because being an adult survivor of childhood incest does not necessarily conclude that these survivors are no longer plagued by psychological and/or emotional trauma. Being a woman alone can come with an inherent set of social disadvantages dependent upon culture, environment, religion, and capability. Common disadvantages can further exacerbate the effects of childhood incest, according to Han et al. 2022. Adult female survivors of childhood incest who lack resiliency, hope, help, coping skills, and social support can experience persistent psychological and emotional trauma that eventually leads to crisis, according to Shake et al. 2021. According to Kay Zadok and David Sinarad 2017, these women tend to suffer from the following struggles, which are common mental health and emotional health struggles. Post-traumatic stress disorder, which involves triggers, flashbacks, dissociation, hypervigilance, and sleep disturbances such as nightmares. They also suffer from depressive disorders such as major depressive disorder, persistent depression, hopelessness, helplessness, suicidal ideation, homicidal ideation, low self-esteem, and low self-efficacy. They also suffer from schizophrenia, which involves auditory and visual hallucinations, paranoid delusions, and delusional disorder. Also, they suffer from anxiety disorders, which involve social anxiety, social phobia, agoraphobia, generalized anxiety disorder, and panic disorder. According to Stensbenhagen et al. 2020, these survivors also suffer from the following: substance use disorder, which involves alcoholism, recreational drug abuse and use, prescription drug misuse and abuse, drug and/or alcohol dependency. And they also tend to suffer from compulsion disorders, which involves obsessive compulsive disorder, body dysmorphic disorder, hoarding, trichotillomania, and exuriation disorder. They also tend to suffer from eating disorders, which involves bulimia nervosa, anorexia nervosa, obesity, and/or binge eating. And also, they tend to suffer from personality disorders, including dissociative identity disorder, borderline personality disorder, and histrionic disorder. According to Lawson and Akai Sullivan 2020, this population also tends to suffer from somatic and medical issues, which include increased heart rate, stomach aches and headaches, and digestive issues, with all four of those previously mentioned issues being related to anxiety and panic disorders. They also tend to suffer from hypertension, which is high blood pressure, sleep disturbances, which includes nightmares, trouble sleeping, trouble staying awake, insomnia or oversleeping, poor appetite, which can be reduced or increased appetite, and muscle tension, which can affect the neck, shoulders, and back. Continuing on from the previous slide, Lawson and Akai Sullivan 2020 also purport that this population also tends to suffer from compromised immune system, which could be the result of high stress, reproductive and gynecological issues, which is also connected to high stress, urinary complications, high cancer risk, a high risk for heart disease, high risk for obesity, a high risk for liver disease, and also generalized pain and discomfort, which could take place in the musculatory system or the skeletal system. Some of the common external social struggles experienced by this population, according to Shake It et al. 2021, includes survivor blaming, minimizing reports on incest, not believing reports on incest, inaction after learning of the survival of incest, rigid gender norms, female subjugation, severe interrelation issues, communication breakdowns, and the survivors being forced to secrecy. Some of the common internal struggles included, which is commonly seen in this population, according to Lawson and Akai Sullivan 2020, includes poor judgment, inappropriate demeanor, social isolation, feeling unseen and unheard, feeling betrayed, feeling ashamed, feeling guilty, and fear of social interactions. Evidence-based crisis interventions for this population includes, according to Niles et al. 2017, mindfulness-based stress reduction, which involves progressive muscle relaxation and guided imagery. These two techniques can be used to reorient the survivor to their presently safe environment of the counseling office, especially when there's dissociation involved in session. Also, according to Vanderkolk 2014, emotion regulation can help these survivors activate their logical thinking brain and help quiet overactivity with their emotions and bodily responses. This can be done because by activating the logical brain, a client can reduce overactivity in the amygdala and the hypothalamus, which is the emotional brain, and in the autonomic nervous system, which is the bodily responses. The way that this overactivity can be quieted can be through grounding techniques and deep breathing. One of the grounding techniques, according to S. Hernandez, Personal Communication, May 19, 2022, is the 5-4-3-2-1 method. This method involves looking around the office and getting the client to name 5 things that they see, 4 things that they hear, 3 things that they can touch, 2 things that they smell, and 1 thing that they taste. It gets the client to activate all 5 of their senses and to get them to think logically about these senses so that they help calm down the overactivity in their emotional system and in their bodily senses. Another evidence-based crisis intervention involves strength-based crisis intervention, according to Hawkins and Clinton 2015, which is also effective for this population. The steps for strength-based crisis intervention include helping the client get to a safe environment and helping them to immediately get grounded so that they can come out of their overactive emotional reaction to their environment, so getting them to a safe space. The next step would be to attend to the survivor's immediate pain. The third step would be identifying and counteracting the most imminent issue leading to crisis. The fourth step would be to help the client get back to pre-crisis state with small, manageable, and realistic steps. The fifth state would be to honor the generalizability of wellness. This particular step means if there is any wellness resulting from any one of the previous steps, acknowledging that wellness is generalizable can benefit the client. The sixth step involves assessing the benefits and costs of problem-solving actions taken by the client. And the seventh step involves building on the client's progress. Cultural considerations that can impact adult female survivors of childhood incest include rigid and twisted religious concepts, patriarchal rule in families, subjugating cultural norms, racism, genderism, discrimination, objectification by society, and objectification by the media and pop culture. As I mentioned earlier in this PowerPoint presentation, there is already a plethora of disadvantages that women go through. This population is affected by the normal disadvantages in addition to what they have been experiencing in their past and the trauma that has been permeating throughout their life up until the point where they hit crisis. According to Jackson, Cherry, and Erfurt 2018, without intervention, helplessness, hopelessness, and isolation have a high possibility of sending this population into a crisis state. Therefore, interventions that facilitate true hope, true help, and true trusted social support are necessary. The Bible supports this need in the following scriptures according to the English Standard Bible 2010. Stronger individuals ought to be there for those who are in need and distressed. Isaiah 25:4. According to Proverbs 31:9, people ought to be a voice for those who cannot speak up, judge righteously, and defend those in need. Continuing on from the previous slide, the English Standard Bible 2010 also suggests in Romans the 15th chapter verse 1 that stronger individuals are to take on the struggles of those who are weaker. Hebrews the 11th chapter verse 1 explains that hope is also a part of the definition for faith. So not only does this population lack hope, but they also may be lacking in their faith. According to Romans the 15th chapter verse 1, God hears the cries of this population, these women, and He can deliver them from their hopelessness. According to Psalm the 34th chapter, verses 17 to 20, God is always near to the brokenhearted. And finally, all who are downtrodden may come to the Lord, and He will provide them with rest, according to Matthew the 11th chapter, verses 28 to 30. Thank you for tuning in to this PowerPoint presentation. I hope that this information is beneficial to you all.